Hello, my name is Ray Comenzo. I'm a hematologist and professor of medicine and pathology at Tufts University School of Medicine. When I see patients and talk to physicians caring for myeloma patients, I'm frequently asked how gene expression profiling is being introduced into the planning of treatment. Gene expression profiling is a powerful tool when it's used to identify the levels of important genes in myeloma cells. Indeed, over the past 15 years, we've learned a great deal about myeloma cells based on gene expression profiling done on a number of clinical trials. However, we have many measurements for myeloma, both in the blood and in the bone marrow. And we currently use as a standard of care a higher level, a cruder level, if you will, of genetic abnormalities in patients' myeloma cells. These are translocations, deletions, losses of certain chromosomes that we can identify by actually looking at the cells and by putting probes into the cells that will allow us to identify these very, very significant mutations. This is not gene expression profiling. This is cytogenetics and fluorescent in situ hybridization. And that technique is the current standard of care for newly diagnosed patients with myeloma. Gene expression profiling is currently being applied, however, in patients with relapsed refractory myeloma in order to identify a signature that has been called high risk. Indeed, there's a company that has a test enabling doctors to identify a high-risk signature. The clinical significance of the high-risk signature in this high-risk population is unknown. And a test like this is always dependent upon the sample itself, how many myeloma cells are in the sample, how adequate the sample is, and the physician's evaluation of the patient, of the patient's blood counts, of the patient's bones, of the patient's kidney function, of the drugs the patient's had, and of the possible therapies available to the patient, actually is much more important than this test at this time. Thank you for your attention.